You know, just a few millimeters beneath your skin, there's this incredible hidden world, a landscape so complex that navigating it takes microscopic precision. It's a world packed with muscle, fat, nerves, and vessels that surgeons have to master. So today, we're going to dive deep into this hidden landscape of the head and neck.
I mean, really think about it. Every single smile, every word you speak, it's all powered by this unbelievably intricate system. For a surgeon, understanding this internal map isn't just, some academic exercise. It is literally the difference between a successful procedure and a life-altering complication.
And here it is. This is our map. I mean, look at this cross-section of the face and temple. It looks impossibly dense, doesn't it? From the skin all the way down to the bone, you've got layers of fat, muscle, and this stuff called fascia. Just think of it as biological cling wrap that holds everything together. This is the terrain we're about to explore.
Okay, so let's start our journey at the very top. We're going to peel back the layers of the scalp. Now, you might think it's just skin and hair up there, but anatomically, it's actually this surprisingly organized 5-layer structure.
Well, surgeons love a good mnemonic, and for the scalp, the word itself is the perfect guide, S-C-A-L-P. It stands for skin, dense connective tissue, aponeurosis, which is this really tough, almost helmet-like sheet of tissue, then loose areolar tissue, and finally pericranium, which is the last layer right on top of the skull. Now, the key thing to remember here is that those first 3 layers, they're bound together so tightly they basically move as one single unit.
Let's zoom in on that 4th layer for a second, the loose areolar tissue. This spongy layer is actually what lets your scalp move around freely over your skull. But it's got this pretty ominous nickname, the danger zone. So why is that? Because it's full of these tiny emissary veins that act like little tunnels, connecting the outside of your scalp directly to the blood supply around your brain. An infection that gets in here can travel inward, and it can do it scary fast.
This image is just wow. It shows that danger zone layer being gently lifted up during a dissection. You can really see just how thin and web-like it is. This incredibly delicate, almost fragile structure is what gives our scalp all its mobility, but it's also what makes it so uniquely vulnerable. So 5 simple layers, right? Easy enough. Well, not so fast. In anatomy, just when you think you've figured out the rules, everything changes. As we move from the top of the head over to the temples, the whole landscape gets way more complicated.
Okay, so let's actually see what I'm talking about. On the left, you've got the nice, straightforward 5 layers of the scalp we just went over. But now, look at the right, the temple. Whoa. Those neat layers have been replaced by a much more crowded structure. See that big fan-shaped muscle? That's the temporalis, one of your powerful chewing muscles. To navigate this area, a surgeon has to deal with multiple fascial layers and all these critical structures packed into a tiny space. You just can't use the same approach here. The neighborhood has gotten way more delicate. All right, let's continue our journey and head down into the neck. Now, if the scalp is like a stack of layers, think of the neck more like a series of compartments. And the master architect of all these compartments is that same biological cling wrap we talked about before, the fascia.
This neck fascia is basically a super sophisticated biological packaging system. It's a series of tough, fibrous sheets that wrap around muscles, glands, and vessels, creating all these self-contained little compartments. This organization gives everything support, but it also creates these very specific pathways, which unfortunately can guide the spread of infections or even tumors. Check this out. This top-down view shows that packaging system in action. Each of those colored lines represents a different layer of fascia. See that yellow line? That's known as the investing layer, and it wraps around the entire neck like a collar. Then you have all these other layers creating these neat little packages for muscles, the thyroid gland, and those absolutely critical blood vessels.
Now let's flip our view and look at it from the front. Seeing it this way really helps you build a 3-dimensional picture in your head. In this image, some of the fascial layers have been cut away, and you can see how they so neatly separate all the different muscle groups. It's this elegant, totally predictable organization that gives surgeons a reliable map to navigate all the important stuff inside the neck. Now, building on that idea of organization, we get to one of the most crucial concepts in all of head and neck surgery, the triangles of the neck. This right here is the surgeon's GPS.
You see, when a surgeon looks at a neck, they don't just see, well, a neck. They see a map of triangles. These zones are all defined by the borders of major muscles. The most important one is that large sternocleidomastoid muscle. It's that prominent band you can feel on the side of your own neck. Go ahead and feel for it. It acts like this massive divider, splitting the neck into a big anterior triangle in the front and a posterior triangle in the back.
And then each of those gets broken down into even smaller triangles, each with its own name, and, most importantly, its own predictable set of contents.
So why is this GPS so incredibly important? Well, because if a surgeon needs to find a specific nerve, or an artery, or a group of lymph nodes, they know exactly which triangle to go into. This is absolutely vital in cancer surgery, where removing the right lymph nodes can be the key to a cure, and avoiding a critical nerve can be the difference between a normal life and a permanent disability.
So we've journeyed through the layers of the scalp, the compartments of the neck. Now let's bring this all together. Let's see how this incredibly detailed anatomical map plays out in a surprisingly common, real-world procedure.
Let's talk about something like Botox. Seems simple, right? Just a quick little injection? But it is truly a game of millimeters. To relax the frontalis muscle, that's the one in your forehead, without causing, say, a droopy eyebrow, the injector has to know exactly which layer they're targeting. Are they in the muscle? Or are they too shallow? Or maybe too deep? That anatomical knowledge is absolutely everything.
And this is where it all comes together. Look at the left. That's the anatomical map. The diagram shows the target, the frontalis muscle, and the precise injection points you need to hit to get the right result. And on the right, the outcome, a smooth forehead, achieved not by some lucky guess, but because the person holding that needle had a perfect understanding of the underlying landscape. This is exactly why the map matters so much.
But what's really fascinating to me is that this map isn't even finished. As this quote points out, our understanding of this anatomy is constantly evolving. It's still developing. Every single year, surgeons and anatomists discover new little details, which helps refine techniques and improve outcomes for patients. The exploration, it truly never stops. So the next time you look in the mirror, just remember that hidden world that's right beneath the surface. It's a complex, dynamic, and just beautifully organized landscape. And it's a powerful reminder of the incredible knowledge and precision it takes to navigate it safely. So now that you've seen the map, will you ever look at a face the same way again?